Welcome back. Pima Medical Institute has some great programs, and today we're learning about their OTA program. Good morning, Sophia. How are you doing today?
Good morning. I'm good. How about you?
You know what? I'm doing great. Every time I talk with Pima Medical Institute about the different programs you have to offer people out there, especially at this time as people are looking for new careers or looking to make a career in the medical field, it's always great to talk with you because we're talking occupational therapy assistance. So what
Correct.
OTA, as we like to say. So
Yes.
what is OTA compared to a physical therapist?
Okay. So, well, there's occupational therapy, and as an assistant, we work underneath the supervision of an occupational therapist, but we carry out all the plans to make sure that the clients meet their goals. And, it's similar to physical therapy where, we still habilitate people back to, independency, but we focus more on their daily tasks. Right. So we focus on the things that you do from the morning to when you go to sleep. So when you wake up and when you go to bed, all the different tasks that you do versus just, and not just, but physical therapy works more on the gait training and walking and the balance. But we work with the holistic individual as far as like their cognitive as well as safety awareness. Are they remembering what their room number is? Things like that is that we're really focused on.
Wow, that's so great. And
Yeah.
what are some of the criteria to get into this program?
So in this program, I mean, what we used to do traditionally before COVID was, you had to observe at least two different settings, so that we know that whether or not you really want to be in this program, if you want to be in this field, it does take a special type of person to get in this field, because you have to have that empathy. You have to be able to connect with clients, and you have to be okay with being very close to them, almost in their personal space, right? So that's kind of what is the biggest part of it. And the rest of it is really, just our normal entrance program to get into the school, but also we interview the potential students and make sure that they understand what OT is, that they have a plan to make sure that they're successful within the program, because we are an accelerated program. I mean, we do 4 semesters of classroom and then they go out and do clinicals. And in the beginning, they think it's slower, but once they get to that last part, they're like, I don't know enough. I'm not ready. So, and they are, and that's what we really try to prepare them for.
Yeah, and you said something that was kind of interesting is that right now with COVID-19, you need more and more occupational therapists because I know they're trying to limit some time of being with certain patients and stuff. So that means there's more needed, so that way you're not having 4 or 5 patients at one time and they can work one-on-one better.
Correct. Yeah. And that's the thing. They have to do, they need to be seen one-on-one. We try to do some group, but you can't anymore, especially with COVID, because you don't want to risk anybody who isn't compromised. Right. And so sometimes you do have it where therapists are working and seeing too many patients and then they get sick themselves. Right. And then now they have to contract out to other therapists who can help out as long as they stay healthy. So, I mean, it's definitely a needed program, a needed field of study, but also in our pediatrics, not only just for adults too.
So, all right, this is the perfect time right now to start looking at classes and start getting involved. So, again,
Yeah.
the classes last for how long?
So classes are about, 16 months. And then the last 4 months is their fieldwork clinicals where they should be at entry level with the setting that they're in. So they come to school Monday through Thursday, 4 hours a day. And for right now, because it's online, a lot of people do feel like they have to work. And so we are able to work with the students so that they can continue to do their tasks that they need to do that earns them those 4 hours in the seats. And they have been excelling tremendously with doing things online and doing things at home. You just have to, I always tell somebody, just grab something that simulates an arm and we're going to start palpating the different bony landmarks of the arm, and so it's really fun that they can do stuff at home as well to simulate that.
Oh, that's great. Sophia, thank you very much for joining us. And I know that a lot of people are probably going to start looking at OTA. to pretty
Yes.
much get into the field. And we have the information on how you can get a hold of Pima Medical Institute right there on the screen. So thank you.
All right. Thank you.